Doctors are often the hero of our stories when we need medical attention, but when they are the ones in need of care, where do they turn? One physician knows firsthand how trusting the doctors at Community Regional can save a loved one's life.
My parents had come in to celebrate my birthday with me, and I had that day off. I was working the day prior. So it was like any other normal day.
Mandip Kang is a neurohospitalist, caring for patients in the hospital with neurologic disorders or diseases that can affect the brain and spine.
My mom just turned to me. She's like, "Hey, your dad doesn't look too good. What's going on?" Immediately, I was like, "Hey, Dad, what's going on? Or can you hear me?" And he's trying to iterate, and he just couldn't.
Dr. Kang called 911, knowing something was medically wrong with his father.
And right when they were taking him, I said, "Please take him to CRMC."
Dr. Kang's father was experiencing a stroke.
When you're at home and you're in your normal clothes and you're just having tea, and all of a sudden this is happening to a loved one, it's very scary.
Dr. Kang found himself as a physician leaning into his colleagues to save his father's life.
We have a dedicated team in the emergency department with our reperfusion team that greets that patient in the emergency to make sure that they receive the care as quickly as possible.
And they took him to the CT scan, and that's when the neurologist was already there in the CT scan, and he asked me, he said, "I think we should push TPA." And I said, "Okay, well, I guess this is happening. I'm going to use your judgment. You're the specialist on call."
TPA is a clot buster that's used to dissolve a clot to get blood back to the brain.
When a person has a stroke, a clot has formed and is stopping blood flow to their brain.
Time is tissue, as we say, so the longer you keep a vessel obstructed, less oxygen goes to the tissue, and it leads to long-term consequences. As soon as they gave the TPA, within about 45 minutes, he could talk again, and he could give me his expressions.
Christine Aubrey, the System Director of Neuroscience Services with Community Medical Centers, says instances like this are why Community Health System has built the Neuroscience Institute that specializes in patient care close to home.
Community Medical Centers has brought together a lot of specialists to be able to support neurological needs for our patients. So we have neurologists, neurosurgeons, neurointerventionists, we have neurodiagnostics, we have pain specialists, spine specialists.
So patients like Dr. Kang's father can get back to enjoying life with his family.
He's totally fine, walking, talking. He's back in Bakersfield, enjoying his daily life.